Welcome back to Way Too Early, 5:30 here on the East Coast, 2:30 out west. I'm Ali Vitale. An Air France flight headed to Detroit was diverted to Canada yesterday after it was discovered that a passenger from the Democratic Republic of Congo had been permitted to board despite Ebola-related travel restrictions. That's according to U.S. Customs and Border Patrol officials, and it comes amid a deadly Ebola outbreak in the DRC, which health officials believe has infected more than 600 people so far and caused the deaths of nearly 140 others. The travel restrictions were implemented Monday by the CDC, banning entry into the U.S. for all non-U.S. citizens coming from the DRC, South Sudan, or Uganda. And today, the Homeland Security Department announced that U.S. citizens coming from those three countries will be directed to Dulles International Airport in Virginia, where the government has enacted enhanced public health measures. I want to bring in MS Now senior medical analyst, Dr. Vin Gupta. Doctor, good to see you. Can you talk about this situation, which is dire, certainly in Africa when it comes to Ebola, but what should Americans be on the lookout for here?
You bet. Good morning. It's great to be here. I mean, this is a very sensitive topic, Ali, as you point out, because this is going to be a regional devastating crisis. We're already seeing loss of life here at a staggering scale, partly because there's been a delay in diagnosis. We believe that maybe the index patient was first infected back in April. And so this 30-day lag due to lack of diagnostic testing, due to low clinical index of suspicion for the doctors in Eastern Congo, all contributed to that. What does that mean for outside the region, the United States, elsewhere? Is there a concern that Ebola may transit through some means to the United States? Travel restrictions, as we've seen in the past, in 2014, of course, with the COVID pandemic, very different virus. They can be somewhat effective, marginally effective. I understand the push to want to do this. Hopefully, it does mitigate the risk of a case here in the United States. I do think that the risk of Ebola to the U.S. population remains very low because, Ali, this is a serious illness. This causes serious symptoms very quickly. So the degree of spread and the likelihood of spread is quite low relative to something like flu or COVID. So low risk to the population, but still regionally quite a crisis in Africa.
Yeah, I think that you're really smart to point out, as always, the ways that this is different than the COVID pandemic, the ways that transmission of this illness is very different. I think that will quell some concerns here. But when you look at what's happening in the region in Africa, one of the things that I've been seeing about this crisis is the ways that by rolling back things like USAID, there are just less resources in that region to help deal with a crisis like this. And I wonder if you can speak to that.
Absolutely. I'll say, as a member of the U.S. Air Force Reserves for 13 years as a critical care doc, the U.S. military we haven't talked a lot about this, but the U.S. military has safeguarded and provides a lot of critical resources, command and control support, logistics in the setting of a health emergency. They did so in 2014 with Operation United Assistance. Ali, they're doing it again, but not nearly to the same extent. USAID, PEPFAR, critical programs that historically did more than just provide treatment. They did critical work in surveillance and diagnostic testing. That is effectively all gone. So you're seeing delayed diagnosis of cases in Eastern Congo, probably worsened and augmented by the fact that the U.S. support no longer exists to the scale that it did 10 years ago. U.S. military command and control support, almost non-existent. We're not even hearing about it. So this is going to worsen what is an evolving health emergency, absolutely. And by the way, we're not communicating with the WHO. Clear lines of communication, data sharing here are critical for rapid response. We're getting in our own way, and that's making this far more worse when it comes to delays.
So continuing to track the ripple effects of the first few months of this second Trump administration. But there's also ripple effects from this. The health secretary, Robert F. Kennedy Jr., has been making some changes to a key health task force here in the U.S. What are these changes and how might they affect Americans' health insurance?
This is worrisome for our viewers, Ali. The concern here is that, just like he did with that advisory committee on immunization practices in his first year as HHS Secretary, RFK now and his team have fired critical members of the U.S. Preventive Services Task Force, we don't talk about what this committee does a lot because we haven't had really a need to do that. Other presidents and administrations don't tend to fire members of this committee before their terms are up. This is not a thing, but this committee essentially establishes what screenings you, I, and the general population should be getting for cancer, for heart disease detection, you name it. And then based on what the recommendations are, and you said this in the tee-up, under the Affordable Care Act, insurers must cover it with $0 copay. $0 copay. So what happens? We don't know what he's thinking when it comes to RFK and his thinking on who future members may be for this committee. What are their views on preventive screenings for cancer and heart disease? You'd think that this would not be controversial, but then ultimately, what does that mean for patient access across the country to $0 copay screenings for these critical diseases? I hope we're not talking about the loss of those screenings and $0 copays, but perhaps that might be on the chopping block.
Yeah, you're right to say that this shouldn't be controversial or even something that is questioned. And yet here we are now having to do that and watching closely what this administration through HHS is doing on this front. MS Now senior medical analyst, Dr. Gupta, thank you. As always, good to see you.